The Health Ministry is seeking views on a proposed bill on patient information. This will govern aspects like the safe collection and sharing of the details across the healthcare system. The ministry says this will facilitate better transition of care. The bill will be tabled in the first half of next year, and it will make it mandatory for all licensed providers to contribute data to a centralized health record system. As many patients are seen by multiple care providers, the ministry says such data sharing makes for a more seamless delivery of care. In turn, providers can make better clinical decisions. Only key health information such as diagnoses, medication, allergies, and lab reports are to be collated. One doctor who has been part of focus group discussions welcomes this move, although there are still some concerns.
This will improve efficiency, reduce medical error, and reduce error rates, in particular in terms of medication mistakes. And also, it will allow us to reduce unnecessary testing. So it does save costs and it does improve accuracy. But there are, of course, some concerns and disadvantages that we need to think about. Number one, of course, you're worried about the security of the system, because essentially this system will be very powerful. It will have all a patient's information, key information inside. So this system will have to be very secure.
The Health Ministry says there are safeguards in place, such as robust cybersecurity requirements. The bill will also explicitly not allow health data to be used for employment or insurance purposes. Patients can choose to restrict the sharing of such information, unless in a life-threatening situation. Sensitive data will only be accessible in certain cases. As for concerns over professional competition, Dr. Wee says the Central Repository, or NEHR for short, will also not take into account personal notes.
For instance, when you see a doctor, the doctor will make certain notes, what we call a clinical entry, where he talk about the history you share, what he found physical exam. So those tiny fine detail at present cannot yet be put into NEHR. And I think that's a safeguard that healthcare providers should have in mind.